కరెక్ట్.
ఓకే, ప్లీజ్ ఫైండ్ అవుట్.
అలాగే సార్,
ఓకే,
ప్రయత్నిద్దాం.
రైట్ అండి, రైట్.
యూనివర్సిటీ నుంచి అసలేం మనకి సపోర్ట్
ఏది
ఉండదు.
ఈసారి ప్రింటెడ్
యూనివర్సిటీ నుంచి మనకి సపోర్ట్ ఉండదా?
10 సెట్లు ప్రింట్ చేస్తే ఎలా ఉంటుందని ఆలోచిస్తున్నాను.
బానే ఉంటది. ఆహా, యూనివర్సిటీ నుంచి మనకి సపోర్ట్ లేదా?
వాళ్ళు ఇంకేం ప్రింటెడ్ మెటీరియల్ రాలేదు అంటున్నారు. ప్రింట్ అవుతా లేదా అని చెప్పట్లేదు. ఇది సెకండ్ ఇయర్ కదా మనం అడ్మిషన్ తీసుకొని, ఆల్రెడీ 1 ఇయర్ ఇస్ ఓవర్. చూద్దాం, మరి ప్రయత్నం చేద్దాము. ఇస్తే ఓకే.
సార్ అది నర్సింగ్లో సార్ వాళ్ళకి అడగాలి. అది బుక్స్ కంపల్సరీ ఉండాలి మనకి. ఎప్పుడు కాకపోయినా రేపు పొద్దున మనకి రిక్రూట్మెంట్ ఏదైనా సరే కానీ మనకి బుక్స్ నెసెసరీ. అదే సార్, ఎందుకంటే ఒక్కొక్క PDF లో 400 పేజెస్ ఉన్నాయి. అవి డౌన్లోడ్ చేసి మనం మెయిల్లో పెట్టుకుందాం ఉందామన్నా అది రావట్లేదు సార్. మనం ప్రింట్అవుట్ తీసుకుందామన్నా నాట్ పాసిబుల్ అది. సో బుక్స్ ఉంటే మనకు లైఫ్ లాంగ్ యూజ్ అవుతుంది ఫర్దర్ గా. సో మనకు నెసెసరీ, ఎందుకంటే మనం అంతగానో పే చేసినాం, 16,000 పే చేసినాం. వాళ్ళు ప్రింట్అవుట్ ఇప్పుడు ఇవ్వకపోయినా బిఫోర్ ఏంటి ఎగ్జామ్ కు 1 month బిఫోర్ అయినా ఇచ్చినా అయితే అంటే మనం 100 members ఉండొచ్చు స్టూడెంట్స్, దానికన్నా ఎక్కువ ఉండరుగా.
అదే అడుగుదాం మళ్ళీ ఒకసారి.
వాళ్ళు ఏమంటున్నారంటే వెబ్సైట్ నుంచి డౌన్లోడ్ చేసుకొని చదువుకోమంటున్నారు. ఎట్లా పాసిబుల్ అయితే సరే, ఒక్క పేజా 2 పేజీలు చదువుకోవడానికి
కష్టం లేండి. అది కాదు,
అది ఇంట్రెస్ట్ రాదు, ఏం రాదు. సైట్ అందరికి అది పాసిబుల్ కాని పని. అది
యాక్సెస్ కాకపోవచ్చు, అంత పెద్ద సిస్టమ్ ముందు కూర్చోడం కానీ ప్రతిసారి వీలు కాకపోవచ్చు. బుక్ మన దగ్గర ఉండి మనం ఏ ఐసోలేటెడ్ ప్లేస్ లో కూర్చొని చదువుకోగలం.
ఇప్పుడైనా చదువుకోవచ్చు. మనం 5 years తర్వాత అయినా ఇది ఏ కాంపిటేటివ్ ఎగ్జామ్, ఫర్ ఎగ్జాంపుల్ NVS, KVS లో యాజ్ ఏ కౌన్సిలర్ గా
మన రెఫరెన్స్ కోసం ఉంటది కదా.
రెఫరెన్స్ కోసం ఉంటది, దేనికైనా యూజ్ అవుతుంది. దానికి కౌన్సిలర్ గా పోస్టులు పడతాయి, దానికి రిక్రూట్మెంట్ కౌన్సిలర్ గా పడతాయి. సో దానికి మెటీరియల్ కావాలి. ఆ టైంలో మనకి మన బుక్స్ మనకి యూజ్ అవుతాయి. మన వేరే వాళ్ళ దగ్గర బయట కొనుక్కోవడానికి ఏం అవసరం ఉంటుంది. మనం ఇప్పుడు చదివిన బుక్స్ అప్పుడు యూజ్ అవుతాయి మనకు.
అవును, ఇప్పుడు
అందరం డిమాండ్ చేస్తేనే పాసిబుల్ అవుతుంది. అది
నేను
ఎవరు మాట్లాడకపోతే అంతే.
అడుగుతున్నా, మీరు కూడా మీ తరఫున నర్సింగ్ గారి ఫోన్ నెంబర్ కి చేస్తారు. ఏమైంది సార్ మెటీరియల్ మాకేం లేదు, వీఆర్ అనేబుల్ టు ఫాలో ఆర్ ప్రిపేర్ అని ఏదో ఒకటి మన డిస్సాటిస్ఫాక్షన్ మనం కొంచెం ఎక్స్ప్రెస్ చేయగలిగితే బెస్ట్. జనార్దన్ రెడ్డి సార్ అని అడిగితే నర్సింగ్ సార్తో మాట్లాడమన్నారు. మరి నర్సింగ్ సార్ ఇంకా ప్రింట్ కాలేదంటాడు కానీ అవుతుంది కాదు అనేది ఏమనట్లేదు.
చేపియాలి కంపల్సరీ, ఎందుకంటే మహా అంటే 150-100 members ఏమో ఉన్నారని సార్ చెప్పిండు. సో టోటల్ స్టూడెంట్ 150 అడ్మిషన్ ఉండొచ్చు మేబీ.
అంటే 2 years కలిపి 2 years కలిపి అనుకుంటా.
2 years కాదు, ఇది 1 year కోర్సే సార్. ఇది
సారీ 1 year. లేలే, మన బ్యాచ్ తర్వాత ఇంకో బ్యాచ్ అడ్మిషన్స్ కూడా అయిపోయినాయి. అది నేను అనేది, అది కలుపుకొని
లేలే, బోత్ ఇంక్లూడింగ్ ఇదే బ్యాచ్ కి. అది ఫస్ట్ యాక్చువల్లీ మన ఇప్పుడు October లో అడ్మిషన్ క్లోజ్ అయింది. దాని తర్వాత UGC మళ్ళా పర్మిషన్ ఇస్తే వాళ్ళు జనవరిలో మళ్ళా అడ్మిషన్ స్టార్ట్ చేశారు. అప్పుడు ఇప్పుడు తీసుకుని ఇది ఒకటే అకాడమిక్ ఇయర్, 23-24 ఒకటే అకాడమిక్ ఇయర్ ఇది మొత్తం.
ఓకే, చూద్దాం మరొకసారి. అందరూ నర్సులు సార్కి ఫోన్ చేసి అడగండి, నేను అడుగుతున్నాను. సో అంటే
అలాగే సరే. ఇంకోటి ఏంటంటే సార్ వాళ్ళని కూడా వాట్సాప్ గ్రూప్ లో యాడ్ చేస్తే, మనం సార్కి చెప్తే ఇదైతే మనం ఉన్న వాట్సాప్ గ్రూప్ లో ఓన్లీ స్టూడెంట్స్ ఉన్నారు. సో ఏమన్నా మనమే కమ్యూనికేషన్ అవుతున్నాం అందరూ. అదే వాళ్ళకి సార్
మన గ్రూపే లేదు కదా.
ఉన్నారు సార్, ఆల్రెడీ క్రియేట్ చేసినట్టున్నారు. నిన్న లింక్ పెట్టినట్టున్నారు, మీరు జాయిన్ కాలేరు కావచ్చు మేబీ.
నాకు రాలేదండి లింక్, మళ్ళొకసారి పంపించమనండి.
అయ్యో, దీంట్లో నేను పంపిస్తాను సార్, ఒకసారి చూడండి.
నాకు పంపించండి. నా నంబర్ ఐడి ఉంది కదా, 9010199773. లింక్ పంపిస్తే నేను జాయిన్ అవుతాను.
వాట్సాప్ గ్రూప్ అడ్మిన్ ఎవరు సార్? ఫోన్ నెంబర్ చెప్పండి సార్.
901019.
సార్ ఇది ప్రెసెంట్ దీంట్లో చాటింగ్ అని ఉంది కదా ఆప్షన్, ఒకసారి చూడండి. షార్టింగ్ అనే ఆప్షన్ లో నేను పంపిస్తున్నా, అందరికి షేర్ అవుతుంది అది.
మీ నా నంబర్ కూడా
చెప్పండి
పంపించండి
సార్.
ప్లీజ్. హలో, మే నో యువర్ నేమ్ ప్లీజ్.
రమేష్ మాలోత్రా.
ఓకే, మీరు పంపించండి, నేను చూస్తాను.
సరే.
యాపిల్ టు ఆన్సరింగ్ మేడం.
పర్సనల్ మొబైల్ నెంబర్ పంపించండి రమేష్ గారు.
పర్సనల్ అంటే ఒకసారి నంబర్ చెప్పండి సార్. అంటే
90
గ్రూప్ లో పంపిస్తే
90
అందరికి యూజ్ అవుతుందని నేను అక్కడ ఇది చేశాను.
ఓకే 90101.
లింక్ పైన క్లిక్ చేస్తే మీరు జాయిన్ అయిపోవచ్చు. పర్సనల్ నంబర్ కి పంపించాల్సిన పని లేదు.
అదే సార్, దానిపైన క్లిక్ చేస్తే డైరెక్ట్ యాడ్ అయిపోతారు సార్. మీరు నేను పంపిన ఇప్పుడు
నేను మొబైల్ లో యాక్సెస్ అయినాను.
అవుతుంది సార్. మొబైల్ యాక్సెస్
వాట్సాప్ గ్రూప్ లో ఎంతమంది క్రియేట్ అయ్యారు సార్?
వాట్సాప్ అది మొన్న 24 ఎప్పుడో క్రియేట్ చేసినట్టున్నారు సార్, నాకు కూడా తెలియదు. నేను నిన్ననే జాయిన్ అయినా.
ఇప్పుడు అడ్మిన్ ఫోన్ నెంబర్ బెటర్ సార్ కొంచెం చాట్ లో.
32 మెంబర్స్ ఉన్నారు సార్ దీంట్లో.
అడ్మిన్ ఫోన్ నెంబర్ బెటర్ సార్ వాట్సాప్ గ్రూప్ లో.
అడ్మిన్ ఏం లేదు సార్, అది లింక్ ఉంటే లింక్ డైరెక్ట్ దానిపైన క్లిక్ చేస్తే అందరు జాయిన్ అయిపోతారు. అడ్మిన్ యాడ్ చేయాలని ఏం లేదు అందులో.
లింక్ ఎక్కడ ఉందండి? నాకు దొరకలేదండి మొబైల్లో.
మొబైల్లో కదా సార్, మీరు ఇప్పుడు ప్రెసెంట్ ఇది ఓపెన్ చేశారు కదా మన ఇది ఆన్లైన్ క్లాసెస్ లో పక్కన చాట్ బాక్స్ అని ఒకటి ఉంది చూడండి.
ఓకే రైట్.
ఆ చాట్ బాక్స్ ఓపెన్ చేస్తే దానిపైన ఒక మెసేజ్ వస్తాయి కొన్ని.
ఓకే ఓపెన్ సార్.
ఓపెన్ అయిందా? దానిపైన క్లిక్ చేస్తే ఆటోమేటిక్ గా యాడ్ అయిపోతారు.
వచ్చేసింది సార్, వచ్చేసింది.
అందులో అడ్మిన్ కి మనం చెప్పాలి ఏంటంటే, సార్లను ప్రొఫెసర్ వాళ్ళు మనకు ఎవరున్నారో అంబేద్కర్ యూనివర్సిటీ నుంచి మేడం సార్ వాళ్ళని యాడ్ చేస్తే మన రిక్వైర్మెంట్ ఏముందో మనకు వాళ్ళకి చెప్తే వాళ్ళకి తెలుస్తుంది.
నాకు చాట్ బాక్స్ ఓపెన్ అవ్వలేదండి.
చాట్ బాక్స్ ఓపెన్ అవ్వట్లేదు సార్?
లేదండి, మొబైల్ నుంచి యాక్సెస్ అయ్యాను జూమ్ లో.
Hello, good evening all of you.
Sir, good evening sir, how are you?
Yeah, I'm good. Sarita Singh.
Yes sir. It's been quite long.
Yeah, yes.
How are you sir?
Yeah. So today onwards, I'll take the class of this personality and assessment of personality. Okay. Am I audible?
Yes sir.
Yes sir.
Yes. How many of you from the BRAOU PG Psychology?
Sir, myself. I'm Tirupati.
You are from Tirupati.
Myself also
Yes,
sir.
sir.
Yeah. What about the others?
I'm also MSc Psychology.
You're also from?
I'm also sir.
You're also from BRAOU or other university of BRAOU?
No. Krishna, myself, Mitra, and a few are there sir, from BRU sir.
Okay.
Yeah, I'm Samsura. I also done this MS Psychology.
Okay.
Good evening sir.
Good evening.
Good evening, sir. We are your students last year.
Yeah.
6 years back.
Oh.
Sir, good evening, sir.
Good evening.
Sir, MSc Psychology 2020 batch, sir. Your student, sir. Kalyani.
Oh, nice to hear.
Thank you, sir.
Kalyani.
Yes, sir.
Good evening, sir.
Yeah, good evening.
Good evening, sir. How are you, sir?
Yeah, good. Yeah,
Good evening, sir.
This second course is
Good evening,
personality
sir.
and assessment of personality. Already, I think 3 units already completed from our professor. Yeah. 4th unit I need to start, no? Is it okay? Hello? Block 2 is. It is.
Yes, sir.
So behavioral approach. Yeah. So we have some approaches of personality, that is psychoanalytical approach and humanistic approach. Same wise, it is behavioral approach. In this block 2 of behavioral approach, we will discuss the principles of classical conditioning, principles of operant conditioning, and the social learning. How these principles of conditioning, like classical conditioning, operant conditioning, and other social learning aspects are related to the counseling aspects, how to do the behavior modification, what is the application. Here in this course of your PG diploma, most of the topics are related to the subject related as well as the practical oriented type of subjects. Yeah. So that is the reason we need to discuss the main core concepts as well as the how these core concepts to be related to our counseling aspects, counseling techniques in our practices. Okay. So today we will discuss this fourth unit of classical conditioning. This classical conditioning theory already studied in your previous course of PG psychology and other UG courses also. This classical conditioning is derived or propounded by Ivan Pavlov, the Russian psychologist in the later 19th century or early 20th centuries. Okay. So here in this classical conditioning, we know there are some conditioning theories. One is classical conditioning theory, other is the operant conditioning theory. This classical conditioning theory, the father of the classical conditioning theory, are the this experiment is propounded by Pavlov's experiment. It's also known as the Pavlov's experiment, classical conditioning experiment, as well as the also known as this Pavlov experiment. In this Pavlov's experiment, one in any psychological experiments in procedural, or you can say any conditioning theories or any classical conditioning theories, or you can say any experiment of psychological subject, there is some protocols, procedures. Those procedures we need to follow in any experiment. As we know, there are some methods of psychology. What are the methods of psychology? One is introspection method of psychology. Second is the observation method. Third is the experimental method. In experimental method, there is some these procedures, that is system stages. Yeah. So here in this experiment of Pavlov's conditioning experiment, Pavlov's classical conditioning, this conditioning is known as the classical conditioning. Pavlov's conditioning is the classical conditioning, whereas the Skinner's conditioning is the operant conditioning. In this Pavlov's classical conditioning experiment, the objective is that to demonstrate the process of classical conditioning in animal. Here they used the dog in this experiment. So in some experiments of our psychological subject, those experiments, some experiments are it is conducted, administered on some animals. That result, the interpretation is applied to the humans. Here, the classical conditioning experiment is on the dogs. Okay, so here procedure is that selection of the subject. Here, dog is the subject because the experiment is administered, conducted on the animal, that is dog. So selection of the subject is on dog. You know, we already administered some tests in your previous first year as well as the second year PG psychology. So same way here, the subject is that animal. So the preconditioning here is the dog is placed in a room or in a chamber. Okay, this chamber condition is that it is well equipped soundproof chamber because the experiment is on the dog. Here the condition, how the stimulus and response, how the condition of how the connecting of this stimulus and response, that is our main objective of doing this, conducting this or administrating this experiment of Pavlov's classical conditioning. Here the objective is that to demonstrate the process of classical conditioning in dog by pairing a neutral stimulus. Here neutral stimulus is a sound, that is a bell, with the biologically relevant stimulus. Biologically relevant stimulus is food here. Neutral stimulus is bell and the biological stimulus is the food. So here, how does this impact of these both stimulus? And we need to observe the development of a conditioned response, conditioning response to the neutral stimulus. I repeat, here the stimulus is one is neutral, another is the biological relevant to the particular animal, that is dog. Okay, that is our objective, observing the response of this particular animal through this stimulus. Okay, now this is our objective. The procedure is that selection of the animal, as I mentioned. Dog is the animal, that is the subject here. Preconditioning, that is baseline of this particular procedure experiment, is that the dog is placed in individual soundproof chamber with all the equipment of how to provide the food, how to observe this dog, and how to measure the salivation of the salvia produced by the dog with some bell or with some sound. That is the arrangements maintained here in this experiment. The arrangements arranged in this experiment. Now, the first phase is the acquisition phase, stage 1. The experiment begins with the presenting the dog with food. Here, in this first stage of this experiment, we provide the food to the dog. In some books they mention that the delicious food of that particular animal. Delicious food. Okay, so the food is provided to the dog, that is unconditional stimulus, which naturally leads to some salivation, this unconditional response. Here the providing food, the food is unconditional stimulus. When we provide this food to the particular animal of dog, the response is producing the salivation. Okay, that is stage 1. In this stage, I repeat, in this first stage of experiment, we provide food, that is unconditional stimulus. So by providing this food, we'll get the salivation from the food, from the dog. That is the unconditional response. Now stage 2 is that, so along with the food, we will provide some neutral stimulus, that is some type of sound before providing the food. Okay, ringing the bell. So here, before providing that food, that is unconditional stimulus, that is providing food, we will provide some sort of sound with bell. Okay, we will produce some sort of sound. The conditioning is that before providing the food to that animal, they need to observe some sort of sound, that is bell sound. Okay, this is the second stage. That is, bell is the neutral stimulus is introduced shortly before presenting the food. Okay, the sound is played, or the bell is, or it may be any type of sound is provided for a few seconds, followed by the presentation of food. First stage, without any condition, we are providing the food, that is unconditional stimulus. The response is the unconditional, because we are providing the unconditional stimulus, that is food, without any condition to the animal. So by getting that food, the stimulus what we are getting from the dog is unconditional stimulus. In stage 2, before providing that food, only few seconds of providing that food, some type of sound, that is bell sound. Okay, with preparation, with presentation of the food, along with the food, before the providing the food, some sort of sound. This leads to the development of conditional response, where the dog starts to salivate at the sound of that particular bell. So here, what are the salivation we are observing in the first day? The same quantity of salivation we will observe by providing this both bell along with this food. That is the stage 1. Here the conditional in the first stage is the acquisition phase. So we are giving some sort of, we are providing some sort of, we are connecting the unconditional stimulus with some sort of conditional stimulus. That is the acquisition phase. In second phase is the conditional phase. As the experiment progress, the dog begin to associate the sound of that particular bell. So you can say it's a conditional stimulus with the presentation of food. That means before providing the food, the dog is supposed to hear the sound of bell. Then only will give the food. This leads to the development of a conditional response. In the first and second stage, unconditional response, because we are providing the first stage only food, that is the unconditional stimulus. Unconditional stimulus, we are getting the unconditional response. So in the second stage of the acquisition phase, along with the food, some sort of sound, that is neutral. Now in this conditional phase, as the experiment progress, after completion of some 1 or 2 experiments, 1 or 2 trials, so here conditional stimulus. The conditioning is that if it get food, one conditioning is that before providing that food, some sort of sound, that is the conditional we are giving to the particular animal. So with the presentation of food, this leads to the development of conditioned response where the dog starts salivate at the sound of the bell, even with the food being presented. Before providing the food, we will give some sort of sound. Okay, this is the conditional phase. Next one is testing phase. Now the dog tested to observe the strength of the conditional response. In this phase, the bell is played without the presentation of the food. Here in the third stage, we are not providing any food, but only the sound. In this conditioning also, it has been successful. The dog should salivate in response to the bell only, indicating that they have formed an association between the sound and the food. That is the testing phase. Again, I repeat, first stage, without any bell, just providing the food. The salivating the dog is the same quantity of his salivation. Then second stage is that along with the food, before providing the food, before few seconds of providing the food, some sort of sound, that is bell sound. In third phase, we are not providing any food, only bell. With the bell sound also the same quantity of salivating from the dog. Okay, so the result, this is an experiment. Okay, the result is that the experiment demonstrates that through repeated pairing of neutral stimulus, that is bell, with an unconditional stimulus of food, the dog have learned to respond to the neutral stimulus with a conditioned response. The salivation is the same quantity in the 3 stages of, if you measure the salivation from this dog, the same quantity of salivation we will observe from these 3 stages. That is the result. You know, any experiment, first one is object. What are the objective? You need to, you are going to get the objective you need to fix before doing any experiment. Second stage is this doing experiment. Third is the result. Now the conclusion is that in classical conditioning, the classical conditioning has been successfully demonstrated, illustrating how the organism can learn to associate previously neutral stimuli with biologically relevant events, leading to the formation of conditioning response. Here, some conditioning. This is the response of the conditioner. You can say it's a conditioned response. So this is the conclusion. We are getting the same type of response in all these three stages. First stage, unconditional. Second is condition, or you can say connection with food along with the bell. Third stage is that without food, even by hearing the sound of bell, also the same point of salivation, the same type of response. This is the experiment of the Ivan Pavlov's classical conditioning. Now the key elements, or you can say principles of classical conditioning. Before that, we will observe the key elements of the classical conditioning. Number one, unconditional stimulus is here. Unconditional stimulus is the food. Food is the unconditional stimulus. ES means unconditional stimulus. UR means unconditional response. When we are providing in first stage, when we provide the food, when we are providing the food, so same sort of response, that is unconditional response from the animal, or let's say dog. So US means unconditional stimulus. UR means unconditional response. Okay. Yeah. Second one is conditional stimulus. Conditional stimulus is that one condition, one connection we are giving here to provide food. Then we are providing food before few seconds of providing that food, some sort of conditioning, that is singing the or providing some sort of sound, that is bell sound. Okay, that is the conditional stimulus. Then conditional response. So the response is the same, but it's a conditional response. In first level, unconditional response, unconditional stimulus. In second level, conditional. What is the condition here? Condition is that to get food, before providing food, this is the sound. Okay, so this is the condition we are giving to get food. That is the conditional stimulus. So the conditional stimulus leading to the conditional response. Okay, these are the some key words in this experiments of classical conditioning. Now, principle of classical conditioning. What are the main principles of classical conditioning? First principle of classical conditioning is that principle of acquisition. Acquisition is the initial learning phase in classical conditioning, when the conditioned stimulus and the unconditional stimulus are repeatedly paired together. It is connected together. Conditional, unconditional stimulus and unconditional response is linked or connected. That is the first stage in this principle of activation. This principle is called principle of activation. This is the first principle. In this example, the Pavlov's experiment, during the acquisition phase, the dog is exposed to the sound of the bell along with the presentation of the food. The presentation of the food is unconditional stimulus. This unconditional stimulus is connected to this conditional stimulus. The bell is the conditional stimulus. Providing the food is the unconditional stimulus. Okay. So unconditional stimulus, unconditional stimulus. Unconditional stimulus is providing food. Conditional stimulus is before providing the food, that is bell sound. As a result, they learn to associate the bell. The dog learned to associate the bell with arrival of the food and started salivating in response to this bell. Okay, so the initial stage, unconditional stimulus, then conditional stimulus. The quantity of the salivating from the dog is the same. That is principle of activation. Then principle of extinction. So extinction occurs when the conditioned stimulus is repeatedly presented without the unconditional stimulus. So here, without even providing the food also, if you observe the salivation from the dog is same quantity. That is principle of In Pavlov's experiment, the dog presented with the sound of the bell multiple times without subsequently delivering food. Even without food also, when we ring the bell, they would gradually stop salivating in response to the bell. So here, if you disconnect this conditional stimulus and unconditional stimulus, so the salivating may be stopped. This is principle of execution. Then third one is principle of spontaneous recovery. Spontaneous recovery. Here in the third principle of spontaneous recovery, this recovery is the reappearance of the conditioned response after a period of rest or without further exposure to the conditional stimulus. Even if the conditioned stimulus is not presented for a while, the conditioned response may be temporarily reappear. For example, after some time without hearing the bell, the dog might exhibit a slight salivation response when the bell is presented again, despite the absence of the food. Even without food also, as I mentioned in the experiment, even without food also, the salivating same point of salivation. This is the principle of spontaneous recovery. Then fourth one is principle of generalization. Generalization is tendency of an organism to respond to the stimulus that are similar to the conditional stimulus. The same type of sound, maybe the bell sound, maybe the other sound. So principle of generalization is that once an association has been formed between the conditional stimulus and the conditional response, the organism or the dog may expect a similar response to the other stimuli that resemble the conditional stimuli. Example here is the dog conditioned to salivating in response to the specific tone of the bell, they might also salivate the response to the similar tone with the similar frequencies or pitches. The same type of sound, if we provide, the same type of salivating we will observe from the dog. This is principle of, so generalizing the sound, that is principle of generalization. Then fifth principle is the principle of discrimination. Discriminating means, so discrimination is the ability differentiating the between conditional stimulus and other similar stimuli. So it is easy to differentiating the different sounds, various sounds. So here the dog may differentiate one sound to other sound. If different sounds are providing here, different sounds are producing here, so it may be possible to differentiate these both sound. That is the reason this animal may not be respond to the different sounds. First one is principle of generalization, fourth principle. Fifth principle is principle of discrimination. These are the five principles of this classical principle of acquisition, principle of extension, principle of spontaneous recovery, principle of generalization, principle of discrimination. Now, what is the importance of, as I mentioned in the initial class, here, what are the theory, what are the principles, what are the experiments, how to apply these theoretical aspects, how to apply this, as I mentioned, some experiments are on the dog, some experiments on the other animals. For example, you can say there are different learning theories, trial and error theory of Thorndike. Trial and error theory of Thorndike is on cat. Is also one learning theory. Thorndike's Edward L. Thorndike's theory of learning is on cats. Here, classical conditioning theory. This is also one type of learning theory, but here we are discussing in the personality approach. Though these are some theories of learning, here our perspective is, our angle of discussion is the approach of personality. Here in this theory of trial and error theory of Thorndike, Edward L. Thorndike, the animal, they conducted the experiment of trial and error theory of learning on cat. Here in this classical conditioning theory, Pavlov's classical conditioning theory. This Pavlov's experiment is on the dog. Same way. Next, what are the theory we are discussing in the later classes? Those theories are, for example, operant conditioning theory of Skinner's is on pigeon or rat. Okay. Same way, some sort of other theories are on some chimpanzees. So here the importance of classical conditioning is that how to apply these classical conditioning theory on the therapeutical procedures. We know that that is therapeutical interventions. At completion of this course, maybe you may be chosen. You have some options of doing your jobs in some therapeutical procedures like behavioral therapies. Okay, how to apply these conditioning theories on the therapeutical interventions? Classical conditioning principle is used in therapeutical interventions such as systematic desensitization and aversion therapy to treat phobia, anxiety disorders, and substance abuse. For example, if the client is having some phobic issues or some sort of, GAD. GAD means generalized anxiety disorders. Some anxieties are specific anxiety disorders. These specific anxiety disorders also known as the phobic anxiety disorders. Okay, for example, some sort of phobia is with height, that is known as the heitophobia. Some clients, some individuals may be having some sort of anxiety when they see the water, that is hydrophobia. Some individuals or some clients, some patients are having some sort of anxiety issues with blood. Or some cases, some clients, they'll have some sort of anxiety condition, anxiety situations when they are in the group agoraphobia. So if you want to provide your service of counseling, if your service of therapeutical interventions to these type of phobic issues. So one that is therapeutical procedure is that systematic desensitization. Systematic desensitization. Here, sensitization, desensitization, and systematic desensitization. What is systematic desensitization? Means systematic desensitization. As I mentioned, three words here, three parts of this technique. One is sensitization, desensitization, systematic desensitization. For example, sensitization means whatever their feelings, I can say, their anxiety. We need to desensitize that anxiety. How? Systematically. Their anxiety to be reduced. That means desensitized systematically, stepwise. Okay. Here, for example, I'll give one example. So if the child or if the individual or the patient is having some sort of anxiety, when they reach the third floor of our this building, because they have specific phobia or specific anxiety, as I mentioned, generalized anxiety and specific anxiety. In this specific anxiety, when they'll anxious, their anxiety will be high when they reaches the third floor of the building. That means heitophobia. In this case, first of all, as I mentioned, sensitizing, desensitizing, systematic desensitization. Just we will ask the patient or the client or the person or the individual to reach the first floor first. Okay. So here, when they reach the first floor of the building, their anxiety will be high. There, some sort of condition, So anxiety with relaxation. Ask them to relax for some few seconds or few minutes in the first level. That is first session, first day, let's say. Then ask them to come to the ground floor. 3 or 4 times we need to do the same practice, same type of trials or same type of practices. Okay, when the next session at the next level, the next stage, ask them, take the patient to the second stair or second floor. Immediately when they reach the second floor, their anxiety will be. Here we need to connect that anxiety, or you can say, ask them to wait for some time, relax, relax, relax. Got it? Then after some time, so their anxiety will be slowly, systematically desensitized, reduced. For example, if they reach that floor, if their anxiety is, for example, their anxiety is 10 points, if they stay for some time, some sort of relaxation techniques, if you apply, if you condition, if you connect to that anxiety, the level of anxiety, maybe when they reach that floor, maybe 10 points, maybe slowly, 10 to 7, 6, 5, like that is after some trials of some sessions. Again, the third stage, ask them along with the therapist, along with the psychologist or maybe counselor, ask them to reach the third floor. When they reach the third floor, same type of experience they have. So connecting their anxiety to some type of relaxation. So this is one type of therapeutical intervention. Then we want to apply this classical, we are giving some sort of connectionism, or you can say condition. Okay. Yeah. So this is one therapeutical intervention. We can apply this classical conditioning theory. Whatever the experiment we are doing, the conditioning theory, we can apply here in this case. Then second, another important thing is aversion therapy. For example, if there's any cases of substance abuse, okay, aversion therapy, maybe some sort of child-related case also, like nail biting, thumb sucking, aversion therapy. When they keep their thumb in their mouth, it would be better to give some sort of this bitter juice in this thumb. Okay, when they keep their thumb in their mouth, so this bitterness, some sort of aloe vera juice, some sort of cutlery juice, we will apply to this thumb. So when they have their this finger in their, they keep their finger in their mouth. So that maybe it is bitter taste. So slowly, what happens? Aversion of doing that problematic. You know that behaviors are different type of behaviors. Okay, you know that BMP, behavior modification program, behavior modification techniques. In the behavior modification program, in the behavior modification technique is one important technique of our therapeutical procedures. Want to modify their problematic behavior. In order to modify their problematic behavior, we will use this type of aversion therapy. Any doubt in this case? Here in this case of this behavior modification, first of all, we need to identify the target behaviors. In behavior modification program, maybe some sort of this problem, you know, some sort of abnormal behaviors and normal behavior. We need to identify what are the abnormal behaviors. Those abnormal behaviors we need to identify. For example, nail biting is one type of abnormal behavior. Thumb sucking, in especially the child cases, child-related cases. Thumb sucking is another important, is abnormal, or you can say problematic behavior. So, for example, the same child is having some sort of restlessness, thumb sucking. So you need to identify the one important is abnormal behavior. Those are that behavior only we need to talk initially. Multiple behavior modifications are not possible. Better to identify the one behavior. You need to give some sort of priority to that behavior only. So identifying the behavior and modifying that behavior by applying these type of theoretical, or you can say experiments. Any doubt? Another one is that exposure response ERP, exposure response prevention. In case of OCD cases, in some sort of OCD cases, exposure is the one technique. ERP, can say ERP, expose response prevention. Expose them to the same condition for some time. For example, some cases, some individuals, they'll have some sort of, they'll face some sort of anxiety situations when they reaches the crowd, when they are in the crowd, when they are in the crowded environment. Okay, so in this case, better to ask them to exposure to be there initially for some 2 minutes only along with the group. When they reaches the group, when they involve in the group environment, so they will have some sort of anxiety. But after some 3 or 4 minutes, if they expose it to the same environment, slowly, initially their anxiety will be high, maybe 10 points, roughly example, maybe 10 points. So keep on them, stay them, exposure them to the same environment, same condition. Slowly, the 10 points may be slowly reduced to 9, 8, 7. Initially, when they reaches the place, then exposure to the environment, the anxiety will be very high. If they are there in the same environment, same condition for some time, like 2 minutes, 3 minutes, 4 minutes, slowly. You can see this on the x-axis and y-axis. On the x-axis of the graphical representation, time. Y-axis is the anxiety points. For example, the first minute, their anxiety will be on y-axis. The anxiety will be 10 points. As the x-axis, if you mention the time here in the axis. So after 1 minute, or 2 minutes, or 3 minutes, slowly the anxiety will be reduced to 9, 8, 7. So this is the one type of system, one type of theoretical technique. If we expose them to the same environment, so the anxiety will be reduced slowly. The conditioning is that we have to be there in the same environment. Okay, here, but when the time is passing 2 to 3 minutes, 3 to 4 minutes, 4 to 5 minutes, slowly, anxiety will be reduced. This is the another important technique of this classical conditioning. Okay, here in the behavioral modification, as I mentioned, first of all, we need to identify the problematic behavior, or abnormal behaviors, prioritizing the behaviors. For example, some cases may be self-injurious behavior. Okay, in that case, you have to give the topmost priority to the self-injurious, restlessness, tantrums. These are all problematic behaviors. If you see the ADHD cases, attention deficiency and hyperactive desires. In these cases, so you need to prioritize, you need to identify the behaviors first. So identify the behaviors, then transactional analysis. Transactional analysis, you need to analyze These type of behavior, whether in the morning time, whether it's afternoon time, whether it's the evening time. The time also we need to check the place, whether it is in the home environment, whether it's in the school environment, whether it is in the other social type of it. Some children, some individuals, they will have some sort of behavioral issues when they reach the social groups, when they are in the social environment, crowded environment. These type of identify, analyzing the behavior, or you can say analysis of the behavior, transactional analysis of the person, maybe environment, the place, the person. For example, the person means along with the mother. So in presence of the mother, they show some sort of behavior. Presence of father, presence of grandparents. So this type of analysis we need. Time, then person, then place. Okay, so this is the behavior modification techniques, BMT, or you can say behavior modification program. We will apply this type of conditioning theories, the behavior modification technique of therapeutic intervention. Any doubt? As I mentioned, hierarchy, identifying the, for example, identifying the problematic behaviors and the prioritizing the behaviors, and hierarchy, fear hierarchy, anxiety hierarchy, then some sort of relaxation techniques also we can apply in this desensitization technique. And another important technique is the reinforcement. There are two important reinforces. Then we apply this type of conditioning these theories. One is positive reinforcement. Second is the negative reinforcement. Positive reinforcement means if some sort of behavior modification, if you observe by train up the child, we need to give some sort of positive reinforcement. Maybe some sort of oral gifts, some sort of object type of gifts. Item-based gifts. Oral gifts means you say very good. That is also one type of positive reinforcement. When they modify their abnormal behavior or problematic behavior to the normal behavior, you need to reinforce positively. Smiling face also one sort of positive reinforcement. If they modify their behavior, you need to provide, we need to give some type of positive reinforcement. That providing positive reinforce also stepwise we have to. And negative reinforces. Negative reinforcement is whatever they need, we can reduce those needs. For example, some sort of play items, they are habituated to the play items. We can tell them, if you are not modify this behavior, these play items I'll reduce. For example, number of play items are 5 number of play items you are providing this. Play material you are providing the child regularly. You can tell them, if you are not in a position to modify this behavior, I will reduce this. I won't provide this type of play items. This is negative type of reinforcement. Positive reinforcement, providing some sort of gifts. That is the third or fourth stage. Initially, as I mentioned, especially in the child cases, initially will provide some sort of moral gifts like get good, very good, excellent, this type of gifts. Even smiling face from the method parents also. That is also one type of positive reinforcement. If they modify their problematic behavior, they change their behavior of abnormal, the normal. These are the things we need to cover. That is positive reinforcement. The same type of behavior, the same type of abnormal behavior, they continues to show that even after train up, even after providing some sort of interventional procedures, better to tell them these are the consequences you need to face if you show this type of behavior. Need to be okay. That's it today's class. So tomorrow, our next condition, that is operant condition theory, we will discuss. Is it okay? Any doubts?
Sir.
Yeah.
One question, sir.
Yeah.
Do we have classes tomorrow? That is on Sunday?
Yeah. Daily we have classes.
Okay, sir.
As the schedule provided, it is daily class.
Okay, sir.
Okay. Tomorrow 7 to 8, the same class.
Okay. Sir.
Okay. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you very much, sir.
Thank you, sir.